Hello everyone. Today topic in discussing blood and blood disorders. What is mean by blood? The circulating fluid including plasma and different cells such as red blood cells, white blood cells and platelets in the vascular system of humans and other vertebrates. Function of blood. First function is the supplies essential of nutrients in cells such as glucose, fatty acids and amino acids. Second function is transport oxygen and carbon dioxide and hormones in the body. Third function is protects from pathogens, blood loss and disease. Helps regulate body temperature. Physical characteristics: more viscous thin water, 100.4 degree of F temperature, 8% of total body weight, average blood volume in males in 5 to 6 liters and 4 to 5 liters in average in female. Physical characteristics: more viscous thin water, 100.4 degree F temperature, 8% of total body weight, average blood volume in males in 5 to 6 liters and 4.5 liters in average in female. Components of blood. Blood is made up of two main components. Blood cells is 45 percentage and plasma in 55 percentage. Blood cells. Three types of blood cells are red blood cell, white blood cell and platelets. Red blood cell is or name is erythrocytes. White blood cell is or name is leukocytes and platelets is or name is thrombocytes. Red blood cells, also called as erythrocytes, big concave shape, elastic cells membrane, non-nucleus. 95% of RBC consist of the hemoglobin. Remaining 5% of consist of enzymes, salts, and other proteins. Contains red blood cell formed in red bone marrow. Average life is 4 months. About 2 to 10 million red blood cells are formed and destroyed in every second. The main function of the RBC is transport oxygen and carbon dioxide. Blood of female contains 5 to 5.5 million RBC per cubic millimeter. Blood of female contains 4.5 million RBC per cubic millimeter. White blood cell, also called as the leukocytes, they are colorless, much larger than red blood cell, and cubic millimeter of the blood contains to formed in bone marrow. Their lifespan depends on the body needs, so they have lifespan of months or even years. Contured white blood cells. White blood cells are without 1% in healthy people. Only 2% of the total IWC population and circulating in blood at a time. Rest is the skin, lungs and spleen. Main function. These are the cells and mini immune system that are involved in protecting the body against both infection, disease and foreign invaders. Types of WBC. Granulocytes. These WBC have granules in their cytoplasm. Granulocytes include neutrophils and eosinophils and basophils. Second is agranulocytes. These are without granules in their cytoplasm. These include monocytes and lymphocytes. Next part in discussing platelets. Platelets are also called as thrombocytes. Platelets are not cells, they are the fragments of the large cells. Nucleic absent, random shape, 2 to 4 micron size. Normal platelet count in 150,000 to 450 drop of blood plasma. Normally 55% of your blood is made up of the plasma composed of approximately 90% of water. Plasma is liquid portion of the blood. Function of the plasma. Plasma helps maintain blood pressure, regulates the body temperature. It contains the minerals, salts, hormones and proteins that perform important function in the body. Disorder of blood. Anemia. a condition in which there is deficiency of red blood cells in the blood. Symptoms: oxygen carrying capacity of blood is reduced, fatigue and intolerance and palsiness, lack of oxygen for ATP and heat productions. Leukemia, neck disease. The uncontrolled production of white blood cells is called as a leukemia and is also called as a blood cancer. Leukemia symptoms: pale skin, redness, a high temperature, fever, weight loss. This is the symptom in leukemia. Treatment of leukemia: the blood of the patient should be changed regularly. It can be caused by bone marrow transplant. It is effective but expensive treatment. Thalassemia. It is a genetically transmitted disease. The patient is thalassemia has abnormal hemoglobin. This disease is more common in children, specifically in children of Mediterranean parents. Treatment is thalassemia. The blood of these patients should be replaced regularly with normal blood. It can be cured by the bone marrow transplant of bone marrow. Transplant is very expensive. Its cure is not 100%. Thank you.